Hello, everyone. My name is Solome Tibabu, and I'm so excited for our Upswing Fund Ask the Expert series. I'm really pleased to have one of our advisors here today with us, Dr. Jack Turbin. To get started, Dr. Turbin, can you just please introduce yourself?
Yeah, thanks for having me. I'm Dr. Jack Turbin. I'm a fellow in child and adolescent psychiatry at Stanford University School of Medicine, where I research the mental health of LGBTQ youth and transgender youth in particular.
Great. Can you tell us more about your research in particular around the mental health of trans youth?
Yeah, so most of my research looks at the determinants of mental health for transgender youth. For instance, we published the first study showing that attempts to force transgender children to be cisgender are linked to bad mental health outcomes, including suicidality. And on the other side, we've also looked at how different types of gender affirmation, so supporting LGBTQ youth for the people who they are, improves mental health outcomes. So we published a paper last year showing that access to pubertal suppression, which helps transgender youth align their bodies to their gender identities, results in lower odds of suicidality. So most of our research looks at how we can best support their mental health. But in general, what that shows is that attempts to try to force people into boxes or rejecting people for their identities usually results in bad health outcomes. In that accepting them and creating warm, loving environments improves mental health outcomes.
Well, I want to come back to that, but first, can you tell our audience what inspired you to go into this field?
Yeah, I was going to be a dermatologist. Can you believe that? I had it all set up. Like I did a whole year. I added a year to medical school where I did this research on mice. I would like put them in little like mice tanning beds and figure out how to prevent their skin cancer. And I was all set to do that. But towards the end of medical school, I did my child psychiatry rotation and started working with kids and doing psychiatry. And I'm obviously biased, but it's the best medical specialty. Like nothing is more fascinating than our minds, I think. And I also started working with transgender kids. And it was really just the most moving experience of medical school. And for me in particular, having grown up gay in Pittsburgh where it wasn't really accepted, I had kind of experienced firsthand how people telling you that your identity is a mental illness or bad or wrong can make a big impact on you. And so I met these kids who were going through something kind of similar to what was going on with kids like me a couple decades earlier. So I was really moved by it. And we also just didn't have a lot of people in medicine and in the mental health field in particular who were dedicating their careers to helping these kids. And I felt like we needed more people. And so I've been doing it ever since.
Wow, I had no idea about that, but we are all very happy that you pursued the path you did because, of course, the demand is so high and the need is so expansive. And of course, grateful for your support of the Upswing Fund. You alluded to this a little bit earlier, but can you tell our audience what is gender dysphoria?
Yeah, it's important to remember that gender dysphoria is not the same thing as being transgender. So being transgender just means that your gender identity, so your psychological sense of who you are as a person in terms of your gender, doesn't match your sex assigned at birth, generally what was put on your birth certificate by the doctor when you were born based on external genitalia. Some people will have this thing called gender dysphoria. And gender dysphoria is a diagnosis that's in the DSM-5. This is the book that kind of outlines most of the conditions that psychiatrists and psychologists treat. And gender dysphoria is when you have severe impairing distress from your gender identity not matching your sex assigned at birth. And that can look different for different people, but it can be really severe. So for instance, I had a patient who I met who was so dysphoric towards her genitals that she didn't go to the bathroom for a prolonged period of time and had intestinal damage and needed surgery. There are many patients, trans masculine patients, who are so dysphoric towards their chests that they'll bind their chests. There are some safe ways to do that, but some people will be so dysphoric or not know about the safe ways that they'll use unsafe ways to bind their chest to flatten it, and they can get skin infections or rib fractures. And so for some people, the negative reaction to their body developing in a way that doesn't match their identity can result in really severe mental health crises. And those are usually the people who it's really important that they have access to things like gender affirming medical care, like the puberty blockers I was talking about earlier, or things like estrogen or testosterone.
Well, especially for youth who are dealing with these kinds of things, they have some unique needs around special mental health and physical health services to support them. What would you say are some barriers standing in the way for them accessing those specialized mental and physical health supports?
Yeah, at this point, honestly, sometimes it feels like more than I can count. But first of all, medical schools and residencies don't invest enough in training physicians or psychologists or other health professionals for that matter in taking care of LGBTQ youth and in particular transgender youth. So we have a huge shortage of doctors and therapists and social workers who know how to support these kids in a way that's really based on research and evidence. And then on top of that, we've seen these recent legislative initiatives that would make their medical care illegal, right? So for the past 2 years, there have been state legislators introducing these bills that would outlaw things like puberty blockers and gender affirming hormones for transgender youth, despite every major medical organization saying that those kind of bills are really dangerous, right? The American Medical Association, the American Academy of Pediatrics, the American Psychiatric Association, the American Academy of Child and Adolescent Psychiatry. I could go on. There's this broad consensus from doctors who work with these kids who know that for some families, taking away this healthcare could be like dangerous, if not life-threatening. But these state politicians have been pushing this forward regardless, and one of them finally passed in Arkansas. And families, understandably, are horrified. The ACLU is bringing a lawsuit to try and pause that bill going into effect. But what's going to happen is that we're going to have even fewer providers. So we were in a bad situation with not having enough healthcare services, and now it's going to be worse. We published a study before that bill went into effect that found that of people who wanted to access pubertal suppression, only 2.5% of them were able to. And you'll hear families say they've been on a wait list for months or over a year and aren't able to access care. So it just seems like the problems are compounding and compounding. Luckily, insurance has gotten a little bit better in covering things. In the past, it used to be really only rich families could afford to pay thousands and thousands of dollars to afford these medications. Recently, insurance has been covering it more, but now we're seeing lawsuits to try and get them to not have to pay for it anymore. So unfortunately, it's just an area that's been really politicized, that's putting these kids at risk when we were already in a risky situation. So long story short, we really need more services for these kids, and access is a big problem.
Mm-hmm. Wow. Now, as somebody who is specialized in this, can you tell us a little bit about what are some of the most important aspects for delivering quality, culturally competent care for trans youth?
Yeah. I have a little bit of beef with the phrase culturally competent, just because I don't think we can ever really be culturally competent, because there's infinite stuff to learn about all different communities. But I think what I encourage people to think about is kind of cultural humility and cultural responsiveness. So acknowledging that there are things you don't know. And if a patient says like, that's not true, listen to them and take it in and apologize. And also really dedicating yourself to like this lifelong learning process of understanding these minoritized communities that you might not be part of. That being said, one concept that I think is really helpful for understanding LGBTQ youth in particular is the minority stress model. This is described by Elon Meyer at UCLA. And he explained that there are two types of factors that make mental health worse for LGBTQ people in particular. The first set are he calls distal factors. So these are things like being bullied for being gay or transgender, being harassed, hearing state politicians say they're going to take away your right to use the bathroom or your right to play on sports teams, um, being misgendered or people refusing to use your pronouns, right? All these external things that create constant stress and make you more hopeless and anxious and depressed. Over time, those distal factors can become proximal factors. And that's when you start to internalize these messages from the outside. So you start thinking, like, maybe I am mentally ill for being gay. Like, maybe I am damaged. Maybe I am like a threat to my peers. I shouldn't go play sports. And you may even know, like, what? Like, I'm not a risk to my friends in the bathroom. Like, that makes no sense. But unconsciously, you've heard it so much that you start to kind of believe it on some level. And then it makes you really anxious and depressed. It can be really hard to undo, but it can be undone over time. And what's really helpful is if any, it doesn't even have to be a healthcare professional, but really anyone in your life can sit with you and say, you know what, like that politician doesn't know what he's talking about. He hasn't met any transgender kids. Like I've known you your whole life or however long I've known you. And like, you're an amazing kid. What? Like you're not a risk to people in the bathroom. Like forget that guy. This is a RuPaul quote, but I like it. But he says, like, I don't have time for the people who are hating on me. Like, I'm too busy loving the people who love me. So just creating those warm, accepting environments and trying to kind of change some of those thoughts that may have snuck into their head that they're sick or they're unwell or they're threatening. None of these things that are true. But it's helpful to hear from a trusted person that, you know, I can understand and validate why those thoughts have gone into your head based on the climate we're living in. But I just want to tell you, I don't think that's true. And I hope that over time you can see that too. And then pronouns, I like to explain because I feel like people get really hung up on it. We had a focus group of transgender adolescents and we asked them the top 10 things they wanted their doctors to know. And one of them was like, get my pronouns right, please. And they explained why. So part of it is right that's their gender identity. If I identify as male, I want people to use he, him pronouns. But also for a transgender person, when someone has not used their name or pronouns in the past, it's often been in a pretty heated environment. So when you use the wrong pronouns, you may all of a sudden become like the bully who beat them up and was misgendering them, or the parent who kicked them out of the house because they didn't accept their gender identity. So kind of understanding that context is important. And if you mess up a pronoun by accident, just telling the person like, I'm so sorry, that wasn't meant to not accept your identity. Like I totally validate your identity and I'm so sorry, I won't do it again. And I'm going to try and use the right pronouns. Like I'm here and I'm on your team to support you. Let me know how I can help. Stuff like that is really important.
What great advice for not only providers, but really everyone. So if I could just ask one more follow-up question, what are some of your favorite resources for families or other caregivers to support LGBTQ teens in their lives?
For caregivers, PFLAG is really incredible. It used to be an acronym, now it's just PFLAG. It doesn't stand for anything anymore, but it's a group that helps parents of LGBTQ youth and can provide a ton of support and resources. And then for kids themselves, the Trevor Project is really a great organization. And they have more resources than people think. So people usually know that they have this crisis line. So if you're in mental health crisis, again, that doesn't just have to mean you're having suicidal thoughts. Just like if you feel like you are in a mental health crisis that's overwhelming, you can call them and someone will support you. You can do it via phone. You can do it on text message if you want to be more private and not have people hear you. You can even do it on the web browser. And they also have this thing called Trevor Space, where you can go on this web forum and meet other people your age who might understand what you're going through being LGBT if you don't have stuff like that in your community, which many kids don't. So if I were to leave you with two resources, I think those would be the two.
Excellent. Well, this has been wonderful, Dr. Turbin. We're so grateful for your expertise at the Upswing Fund for Adolescent Mental Health and all that you're doing for transgender youth and their families and providers at large. Thanks so much for joining us.
Oh, thank you.